Well, actually, why don't I explain what we're doing by starting with this fly here.
This is a fruit fly.
This is a fruit fly. This is, in fact, the one that when you have fruit around and they're annoying, it's them. And what this actually, this fly is a patient, or it's not a patient, but it represents a patient, what we call a personalized fly avatar. And what you're seeing here is we've labeled, this is an interesting patient. I think we'll also explain what we're doing. This is a fly to bedside open clinical trial that we're running now. And then we can talk more about the thinking behind it. What you're seeing here is a model of a patient where it has 5 mutations in it. So this patient has a thyroid tumor. And that thyroid tumor is mainly driven by a mutation that everybody in the field knows about called RET. And as Ken said, we didn't just pay attention to what's called the primary drivers. So in precision medicine, it's all about identifying these key cancer drivers, usually one, and then trying to drug that with precision, hence the name precision medicine. So we're not doing that. Instead, this patient has RET and then 5 other mutations that have never been linked to cancer, probably, as far as we can tell, don't even really contribute to the tumor. But when we put it all together in their personalized fly, this fly no longer responds to any of the drugs that were developed for thyroid cancer. And actually, we developed one of them. And so the punchline here is this. It's a big data thinking about cancer, which is we try to put everything into the fly that we see in the patient. Here's another fly that has so-called metastasis. You can see in its mouth, the proboscis up high, and the tumor is spreading through its body, similar to what's actually happening in the patient. And in fact, the reason the patient's in our trial is because they're not responding to the standard of care drugs. And we see that in these flies. So what we've been doing, I'll hold off on this a second. What we've been doing, and I'll explain this in a bit. What we've been doing is we actually built a personalized fly avatar for this and a number of other patients. And then we use robotics. We grow up 200,000 of each patient's personalized fly. They're all identical. They all have tumors growing in them. And then you use the robotics to screen 1,200 FDA-approved drugs in various combinations. So the number of combinations we screen is insane. To identify one or typically 2 to 3 drug cocktail that's personalized for that patient. And then we work with the oncologists. We have various committees that vet the data. And we work with their doctor to suggest a treatment. If they choose to take it, then we consent them on the second arm of the study. And so we've been focusing on colorectal and thyroid. And the trial opened up in September. So this is a very different way of thinking about it. You might say it is what Wayne Gretzky would say, we're trying to skate where the puck will be, which is complexity, big data, as opposed to where it is right now. And of course, this approach will, the future, I think, is going to be approaches like this. We'll get together with approaches like in immunology. And we're working with immunologists at Mount Sinai, like Nina Bardwaj, to try to create a cocktail of therapies, which I think is really the future of cancer therapeutics.